That means that you're going to have to raise your hand, you're going to have to repeat what I say, you're going to have to write some notes down, and then I'll get Bill up here, and then he's going to teach the class, and I can leave. I'm going to run out this place, right? Bill's been here like 57 times, so he knows every word that I'm about to say. So, this is what we're going to be doing tonight, right? And the next, I want to keep some space here for the questions. Ryan's got questions, which we don't want to skip that. But probably I'm going to spark some. You'll have some questions by the time we're done. I want to make sure I take the time to do that. Are you guys okay with that? Right. Our topic tonight is, it's going to be on the thyroid gland. Obviously, there's over 20 million people, according to the Cleveland Clinic, that people have thyroid problems, or they have symptoms of thyroid problems. But as you will soon learn, that a lot of times people have symptoms of thyroid problem, but yet they don't have a thyroid problem, which is kind of, maybe a little bit harder to understand or more complex. But, as we go through this, you'll have a better understanding. Does that make sense? So let's go through this here together. There's 20 million people in the United States, some kinds of thyroid condition. We're going to define what that means. Those are the symptoms. I don't know if you can see this here with the light, but there's a lot of symptoms that people that have thyroid problem, like people having some fatigue, having some weight gain, morning headaches that wears off as the day goes on, people having depression, constipation, being hypersensitive to cold, having poor circulation, numbness in your hands and feet, muscle cramps while you're at rest, increase your susceptibility to cold and other viral and bacterial infection, and difficulties recovering from them. When you have some kind of wounds, it's going to be slower to heal. You're going to have excessive amount of sleep. You're always tired. Chronic digestive problem, itching, dry skin, dry, brittle hair falling out easily. We've seen a lot of that, especially post-COVID. People having some swelling, loss of the outermost portion of your eyebrows. Everybody has that? Can you do this here for me? Everybody has that? Yeah, okay. If you have it, then that's good. That's a good start. If it's pretty thin, you could have thyroid problem. Right, and this last one here, it says, we'll talk more about that. Maybe we'll start with that today. It says high lipid profile. So this is something that is kind of important. I'd like to touch on that. This is like a very in-depth subject, but I'll be touching on the most common. So when people have problems with their cholesterol, oftentimes the doctor is really quickly, want to put people on cholesterol reducing medication. However, I always tell people, if your thyroid hasn't been checked or you don't know how your thyroid is doing, when your thyroid is slow, meaning when the motor is not running at where it needs to be, then your cholesterol is going to go up naturally. That's normal. So if the thyroid doesn't work properly, the cholesterol is going to go up. Are you going to remember that? Everybody's going to remember that? Yes or yes? Yes. The answer is yes. Right? So if a person has issues with their lipid profile, what should you be asking the doctor to do? You should ask them to check. Yeah, you should ask to check your thyroid gland, right? Because they work together, and many times they don't do that. Why don't they do that? Is because I don't know. It's probably much easier to just give drugs to people for their cholesterol, and then give them drugs for their thyroid, and then give them drugs for everything. Right? But our goal here is want to find out what's causing the problem. Right? Whatever symptoms that people have, people are just famous. I mean, I'm no different than most. I mean, I go on Dr. Google once in a while, right? However, people are everybody wants to look the symptoms that they have and then make their own diagnosis of, the problem is. Unfortunately, the vast majority of downhill people are wrong. They don't know what they're looking at and what that means. So here it says do we treat the thyroid? It says, I want you to be thinking outside the box today, right? To understand that your thyroid is not just working by itself. It's not the only player. Jim was referring to that earlier, and he was mentioning that in order for your thyroid to function properly, your adrenals have to be healthy. And if your thyroid is not working properly, then oftentimes the adrenals might not work properly. They might not work at all. Right? When it's all said and done today, I'll be able to explain a little bit more about that so you have a better understanding that, your thyroid doesn't work by itself. That's really what I want you to know. Right? I want you to know that your thyroid doesn't work by itself. Yes or yes?
Yes.
Your thyroid doesn't work by itself. So if you were to go to the doctor and the doctor said, well, your TSH, which is, just so you know, if you go see the endocrinologist today or the medical doctor, they're only going to look at one number. They're only going to look at one lab test, right? The vast majority of them, they're only going to look at one unless you ask them. And that one test they're going to look at is the TSH. And the TSH is your thyroid stimulating hormones, right? And your TSH is produced in your pituitary gland. It's sending a message down to produce thyroid hormones. So today in medicine, even the endocrinologists, for the most part, the vast majority of the time, 25 years in practice, the vast majority of the time, they only look at this one thing. And then based on this one thing, they're going to treat you based on that. Right? So if your TSH is above 4, they're going to be like your thyroid is slow, then we're going to give you thyroid medication. Some form of thyroid medication. If your thyroid is low, which it could happen, right? You have hyperthyroidism, which is less common, then we also have medication for that. So unfortunately, you have no chance. They'll give you something one way or the other. Yes? Okay. So here it says, why do we have those symptoms? Is it the thyroid or something else in the body that is affecting the thyroid? So we're going to go through every one of those, right? That there's a lot of different causes for people to have a, to have a thyroid that doesn't work properly. And I want you to understand those, not that you need to become a master, but I just want you to know that it's a bit more complex than just saying, well, my thyroid doesn't work properly, my doctor did a TSH, and then my TSH is high. Most of the time, that's what people have, right? And when the TSH is high, then we're going to give you drugs based on that. And that's it, right? Oftentimes, I'll ask people, I'm like, well, did they check your TPO? Now, you don't know what the TPO is, but those are enzymes that if they're high on your test, that means that your thyroid gland is self-destructing. That means that your immune system is destroying your thyroid gland. Now, is that a problem with the thyroid or it's a problem with your immune system? Right? So when people have thyroid, if you have Hashimoto's thyroiditis, which is a form of people that have hypothyroidism, it's called Hashimoto's, which is very common today. It's an autoimmune disease. That means your thyroid is being self-destroyed. You definitely want to see what the TPO is on a blood test. And the reason why you want to see that is because you want to know if your thyroid is being destroyed by your own immune system. And if it is that a thyroid problem or is it an immune system problem?
Yes.
Right? It's an immune system problem. So you want to find out what needs to be done. Does that make sense? But if you go see the medical doctor or the endocrinologist, the vast majority of the time, they're going to treat the TSH. You won't even look at it. And then they're going to be like, we're going to treat you based on that. Now, the problem with that is you might be feeling better temporarily, taking some synthetic hormones. But what happens is if you truly have an immune system problem that is self-destroying your own thyroid, there's a reason for that. So, for instance, if a person is, allergic to gluten, and gluten is the protein in grain, and if it's attacking your thyroid gland, then when you take more of the thyroid medication, temporarily you're going to feel better, but depending how much of that gluten you put into your body, this will determine how you feel. This will determine how your thyroid is functioning. Do you follow me? Because now we haven't got to the cause. Do you follow that? So that is something that is important. So here it says pattern of hypothyroidism. We're going to run through, a handful of them just to create enough confusion, enough like this is hard, but I don't want to make it hard. I just want you to know that it's a bit more complex than what most people think. And I want you, if you have a better understanding, you'll be like, hey, that makes sense. Right? So number one here, it says primary hypothyroidism. It says your pituitary gland is sensing that your thyroid, right, your thyroid gland is not doing its job, so it's going to pump more of the TSH. Right? So your pituitary gland, it's in your brain, is sensing that your thyroid gland is not doing its job, so it's giving you more of the TSH. So this is called primary hypothyroidism. So if there's not enough hormone, there's this negative feedback loop that goes from your thyroid to your pituitary. And if there's not enough hormones, then your body's going to signal your pituitary to produce more TSH. You follow me? Right? So that's number one. That happens. Doesn't happen very often. Then you also have number two. It says hypothyroidism secondary to your pituitary hypofunction. Right? So what that means here is now you have a different pattern. The pattern is your pituitary doesn't work properly. So if this upstairs doesn't work properly, then it's never going to be sending the right message for you to have more TSH. Does that make sense? So if this doesn't work right, this is not going to work right. So this is secondary when the pituitary doesn't work properly. This can be affected by stress. I know that you guys don't have any of that. Number 2, it says postpartum depression. Right? Number 3, it says thyroid medication. So when people are taking now, I want to tell you a little bit about hormones. When you're taking thyroid hormones or any kind of hormones today, this is there's a lot of wellness doctors around. And wellness doctors that do functional medicine, many of them, they do hormone replacement therapy. Dr. Jean-Guy is not opposed to hormone replacement therapy. However, when you're like 30, 40, 50 years old and you start taking hormone therapy, you start taking hormones from the outside in. If your body's supposed to be producing hormones, let's say thyroid hormones, and now you start taking it from the outside in, what is your body thinking? Your body goes on vacation. And when your body goes on vacation, then it stops producing. Do you follow me? Right? So now you can start taking hormones from the outside in. You're going to make your blood test look good, right? But what is your body doing? Your body's going on vacation. So those organs that are supposed to be producing those hormones, they're just going to stop doing it. Is that a good thing or a bad thing? Right? If you're 70, 80 years old, I mean, that's fine. Right? However, I would still kind of, battle that myself, because first and foremost is you want to build the foundation. Right? Building the foundation is you have to be nutritionally sound. So if you don't have the raw material, even when you take hormones, even when you've attained the, the wisdom, right? When you get to be like 70, 80, and 90, when you get to attain the wisdom and the right to get hormone replacement therapy, if you're not nutritionally sound, you're still going to get limited benefit. Do you follow me? Versus if a person is nutritionally sound, meaning that they have all the raw material in their body, right, in order to feed those organs. So then the body, if you were to take hormone replacement therapy, right, your body would be doing better with that. Does that make sense? Right? So the foundation is always the same as to make sure that the person is nutritionally sound. So this is the basic. So as you're looking here, it says second, right? That's a second example. So there's 3, there's more, but for tonight, there's 3 things here. So stress will affect that, which is just about the whole world. And then number 2 is postpartum depression. So you see that. So when mom are going to, they have this baby, right? Those kids, they just cause a cramp or style. And so what happened is when those kids come in, right, then mom starts, you have all this hormones blend there that happen for 9 months, and then you deliver the baby, and then you nurse, and so you have all this thing going back and forth between all those different, area between your hypothalamus and your pituitary and your thyroid, right? So this is not an uncommon thing. And oftentimes the mom thinks that it's like, it's all, or people around, it's all in my head. But that stuff is for real. Okay, so now the thyroid medication, when you take medication from the outside in, your body goes on vacation. So then what happened is when you're taking that thyroid hormones, then your thyroid tells your pituitary to stop producing. If you follow me, it's going to stop producing because now it's coming in from the outside. Now, one of the questions that one of you here will have before we leave tonight, then I would just want to answer that right now. Are you ready? So there's always a person that comes in at the end and say, Dr. Jean-Guy, you convinced me. You know what? I'm taking this thyroid hormone and I want to be off of it. Can I just be off of it? And my answer to you is no. Right? And the reason why I'm saying to you no is the answer is yes, but no. The answer is you could be off of it of some, I don't know how much. When a person has taken thyroid medication for 10, 15, 20, 30 years, your body's been on vacation for a long time. Do you understand that? Right? So when I start working with people to feed them nutritionally and give them, you can use herbals and you can use whole food and you can use Chinese and you can use all kinds of things to turn the thyroid around. But it just depends. You're going to be able to do it at which the level has, the body has the ability to turn around. You follow me? Right? So if you've been on vacation for 40 years and you've been giving thyroid hormones from the outside in, it's probably less likely to be able to get off of it. Does that make sense? Now, does that happen that people can be off of it if they've been on it for a few years? The answer is yes, it happens all the time. Right? Because now the body is still has this remembrance that I used to be producing this stuff, so then we can wean a person off and you can allow the body to do it on its own. Do you follow me? So there's always this one person at the end, they're like, Do you think I can just be off of it, right? By tomorrow? Of course, by tomorrow too. Number 3, it says thyroid is under conversion. It says associated with chronic adrenal stress. So Jim was talking about that today, right? So when you have, if the adrenal glands are just little, it's a little gland right on top of your kidneys. And those glands are in charge of your energy, your stamina, your vitality, your hormones, your immune system, your sleeping. That's what the adrenal glands do, right? It's in charge of your energy, your stamina, your vitality, your hormones, your immune system, your sleeping, anything that has to do with stress. So when a person has been under stress for a period of time and the adrenals get beat up, right? Then when the adrenals get beat up and they start getting tired, then what happens is naturally, can you say naturally? Naturally, the thyroid's going to underconvert. Naturally, it's going to happen automatically. That means that the thyroid's going to start getting slow because the adrenals don't work properly. Does that make sense? And it will happen naturally, and it has nothing to do with the thyroid, but yet the person would have some thyroid symptoms that if you were to go see the doctor would want to put you on some thyroid medication. Right? But that's not the problem. It's because the adrenals don't work properly. There's a lot of people that use the term like adrenal fatigue. So in the medical literature, they don't really use that word anymore. They use this thing called HPA axis dysregulation. And that's just like a big word. It's called the hypopituitary adrenal axis dysregulation, meaning it just get like the signals is not happening properly. You follow me, right? HPA axis dysregulation. Are you going to remember that? Okay, well, you don't need to, so that's a good thing. Okay, so here's what's happening, right? So now listen. Are you ready? So it says cortisol prevents enough conversion of T4 to T3. This is the active form of the thyroid hormones. You follow me? Now cortisol, it says high cortisol. Cortisol is being produced in your adrenal glands. So when a person is under stress, your adrenal glands have to produce a lot of cortisol because that's how your body manages the stress. It's like the lion comes out of the cage and it's chasing you. So when cortisol is high, the conversion from T4 to T3 is going to start going down. So is the thyroid the problem? It's not, right? It's secondary to the adrenals not working properly. So when people have thyroid problem, right, you have to be doing a little investigation. So that is number 2. It says deterioration of the cell membrane prevent the conversion from T4 to T3. Then here it says inflammation and infection. I know this is hard to understand and people don't. I've had people over the years, right? They're like, Dr. Junkie, I just want to work on my hormones. I just don't care about anything else. Right? Because let's say, for instance, you test the person and they have like some parasitic infection or a person have some viral infection. So when people have any kind of immune burden on the body, the immune system drives the endocrine system. Okay, you're going to say that with me. The immune system drives the endocrine system. So if the immune system doesn't work properly, then what happens is you're going to see this here happening. It says deterioration of the cell membrane prevents the conversion, right, from T4 to T3, which is the active form of the thyroid hormones, because you either have inflammation or you have an infection. So are infections common today? The answer is yes. You could have an infection with no symptoms. Infections are common. People can have parasites, people can have virus, people can have bacteria, people can have yeast, fungus, they have all of that. And most people do have that. Do people have inflammation? Yeah, for sure people have inflammation because when you eat cake, cookies, candies, ice cream, bread, rice, and pasta, of course you're going to have inflammation, right? Inflammation is anything that is either sugar or breaks down into sugar will cause inflammation in your body. So inflammation is common. When you have inflammation, then what happens is the cell membrane, your cells, there's 70 trillion cells in your body. How many? 70 trillion cells in your body, and all those cells are all made out of fat. Right? All those cells, there's 70 trillion cells that are all made out of fat. So is fat important? Yeah, should you be eating fat? Yeah, you should be eating fat every day. It should be like dripping all over your face, right? Every day, right? You should have butter, you should have coconut oil, you should have avocado oil, you should have avocados, you should have like all those things. There's 70 trillion cells, and if God did not think that that fat were important, right? You would not have 70 trillion cells made out of fat, right? You follow me? And that cell membrane is very rich into omega-3 fatty acid. So I tell people, I'm like, listen, you should take like, this is Nutrition Basic from Dr. Daigneault. I tell people you should take, you should take fish oil every day. For how long? For the rest of your life, until the day you croak over. Right? Why is that? Because there's 70 trillion cells in your body, and when you don't have like enough omega-3 fatty acid to make up that cell membrane, to make it more fluid, right, and it's more nice and mush there for things to happen inside and outside, right, what happens is your body's not going to be able to work properly. Does that make sense? Plus, omega-3 fatty acid, they're good for your eyes, they're good for your cardiovascular system, they're good for your immune system, they're good for your lungs, they're good for your joints, they're good for your muscular system. What else do you want to know? They're good for everything. Just take it. Right? Okay, so that's number 3. Just thought I'd keep you awake here. Right? We're going to go home early tonight, because I promise. Number 4, it says you have the thyroid overconversion and decrease in thyroid binding globulin. So now you have an overconversion, right? And then it says a decrease your thyroid binding globulin. It says elevated testosterone in women. So if a person has an imbalance in hormones, like testosterone in female, right? Then what's going to happen is you're going to have issues with how the thyroid will function. It says it will create too much T4 to T3. Then we have resistance to the thyroid hormones. So what happened is, so now this is important. So too much, it's like not having enough. Now remember the cell membrane? You just learned about that, yes? Yeah. So the cell membrane is very protective, and what that means is there's only like so much that it's going to let in. If there's like a bombardment of that thyroid hormones to get inside the cell, at some point in time, those receptors on the cell membrane, they're just going to shut themselves off. Do you follow me? Right? You're like, I have no idea what we're talking about. That's okay. Right? What I'm saying to you is, there is such thing as, too much versus not enough. When people start taking hormones, the body doesn't know the difference between not having enough versus having too much. Because what happened is the cell membrane is the gatekeeper to let things in. So when you have this overconversion, then what happened is the cell membrane is going to be like, I'm not letting this thyroid hormones getting into the cells in order to be activated. You follow me? Right? Say yes.
No.
Even if it's no, say yes. Okay? And then number 2 here, it says found with insulin resistance and then PCOS. I was just on one of those webinars, right? That this is kind of interesting that when women have polycystic ovarian syndrome, which is very common today, right? That usually you start giving some metformin to those ladies, and then they start doing better, right? So metformin was supposed to be given to people that have sugar problem. Now we're giving it to the ladies that have PCOS, and then they start losing weight, and then they start feeling better, and you start balancing out their hormonal system. But the reason for that is because metformin, what it does, right? What it does, it helps with insulin, right? With insulin resistance. Now, I mean, in Dr. Daigneault's world, I would not address it that way. I mean, you just stop eating cake, cookies, candies, ice cream, bread, rice, and pasta, and we can do the same thing. But in the medical world, how we handle this is we're going to give you those, those drugs like metformin, and then this is going to be, that's going to be the outcome. You follow me? Right? So people start taking metformin, they lose weight, they're like, oh yeah, I'm happy, I don't want to stop taking that drugs, that's good for me. Just as an FYI, there's no drugs that are good, right? I mean, you can give a drug to a healthy person, they're going to get sick. You understand that? Right? Is a person healthier when they take more drugs or less drugs? Should that be your goal in life, to take more drugs or less drugs? Yes. Okay, very good. So we are in agreement on one thing. Okay, so here it says thyroid overconversion and decreased thyroid binding globulin. So, elevated testosterone. This next one, number 5, it says thyroid binding globulin elevation. So this, when you do a blood test, this is on the blood test. When you do it on the blood test, you can see that. Now, regular doctors, usually they don't do those tests. I tell people, if you're going to go have a blood test, you want to have the TSH, you want to have the thyroid globulin, you want to have the TPO, you want to have T4, T3, reverse T3. Why do you want that? Because you want to have, you want to see the whole movie. Right? Can you say the whole movie? Oh. I want to see the whole movie. You don't want to see just 10 seconds of the movie. You want the whole movie. If you don't have the whole movie, then you don't know what's happening. Do you follow me? So you want to have the whole movie. Now, part of the whole movie is what the thyroid is doing, but then you also want to see what those other guys around are doing. Right? So if a person has excess estrogen in their body, well, the thyroid is not going to work right. If you have excess cortisol in your body, your adrenals are not working right, so your thyroid is not going to work right. Do you follow me? We want to see the whole movie, right? Who wants to see the whole movie? Yeah. That's the reason why it's very misleading when you go to the doctor and they only check your TSH. It's frustrating because people start taking the drugs, they still don't feel good. Right? Because we haven't got to the real problem. So it says thyroid hormones will bind to the thyroglobulin, right? To thyroid binding globulin. Therefore, not enough free hormones can enter your cells. Right? So your thyroid hormones will bind to the TBG, therefore, right, you're not going to have any free hormones to get into the cells. So here it says associated with birth control pill and estrogen dominant. That's really common. It says or replacement therapy when people are taking this Premarin. Right? This is synthetic estrogen. It's like estrogen coming from a horse. Yes? Take the birth control pill. That's what they do to young ladies, right? You're 12 years old, you have cramps, you have a heavy flow, we'll give you the birth control pill. Because we're so smart. And we're going to give you this for the rest of your life until you want to have a baby. And then when you want to have a baby, then nothing is working, right? Because, of course, people want to have a baby now. So they get off the birth control and they're like, well, next month I want a baby. I mean, you've been messed up from the time you were 12 years old. You're still messed up. You just didn't know you were messed up. Right? You see how that works? It's just like, so people have had problems for a long time. They just didn't know because we just give one drugs after another to just cover up the symptom. But we don't want to do that. We want to get to the core of the problem. Does that make sense? Right? So it says number 5, your thyroid elevation, right? So associated with birth control pill because it's synthetic, it's estrogen in nature. And then here it says estrogen dominant. So today in the United States of America, it's very common. I don't know about other countries. Canada's likely to be the same, but there's a lot of women that have estrogen dominant. How do you know if you're estrogen dominant? Right? You'll know if you're estrogen dominant if you have those little red spots on your skin. Those are called hemangioma. You are estrogen dominant if you have it. Right? You are estrogen dominant if you've been having heavy cycle all of your life from the time you were a little girl and you've been having cramps and heavy flow and you're grumpy and you have you were told that you have whatever symptoms you've had, and then they put you on birth control pills because you were estrogen dominant. The food that we eat in this country today, it's being sprayed with glyphosate. It's being sprayed with pesticides, herbicides. And all of those are estrogen. They're xenoestrogen. Do you know what that means? Xeno means foreign, meaning that when they get into your body, they act as estrogen. So they're xenoestrogen. So people don't know that. So we've been exposed to this for decades. And you're putting it in your body every day. And then what happens is then you have livers that are just not working properly. And when livers don't work properly, their job is to take you through this thing called phase 1 and phase 2, liver detoxification. This is how your body gets rid of the excess estrogen in your body. Right? So when you have excess estrogen in the body, you're going to have issues with the cycle for sure. You're going to have all kinds of symptoms that usually you're going to go see the OBGYN. The OBGYN is going to open up the toolbox and gives you what? He's going to give you a pill, and it's likely going to be the birth control pill to try to regulate your cycle. But you're already messed up. But you don't know you're messed up because you're like, everybody around me is messed up, right? But you don't call it messed up. You're like, well, all my friends are like that, so that must be normal. I'm just like one of them. So then they put you on those drugs for the next 15, 20 years, but you still have those problems. Now you're just making the problem worse. Because what happened is you eat cake, cookies, candies, ice cream, bread, rice, and pasta, and then all the stuff that we put in our body, all the grains, they all have pesticides on them, right? And then you walk barefoot on the grass, and there's pesticides, there's herbicides, pesticides, just name it, it's there, right? And then what happened is when you have excess estrogen, then you have those cancers like breast cancer. Many of them are driven by estrogen. And why are they driven by estrogen? Because there's different types of estrogen, but your liver is in charge of getting rid of the excess estrogen. But when you're overwhelmed with estrogen, your body cannot do that properly or effectively. So then guess what happens? So then the body loses control. Did you know that your body goes in and out of cancer cells 40 times a day when it's working properly? But when it loses control, that doesn't happen anymore. And what happened is the breast has a lot of fatty tissue there. Yes or yes? Yeah. And then your body used the fat to store the crap. Do you follow me? Right? Your body used the breast to store the crap. So now we have a solution for you. We're just going to chop them off because they're just spare part. Right? And then we're going to give you tamoxifen for the rest of your life. We're going to suppress the estrogen in your body because those are cancers that are being driven by estrogen. So I want you to think about that here because this is really important because this is all relevant with all the problems that, you know, men and women have is not understanding how the body works. And this estrogen thing is a big deal. That's the reason why cleansing is really important. Right? If you've never done a cleanse, you should be thinking about, you know, cleansing on a regular basis. And don't just do a cleanse like, oh, I'm going to cleanse my gallbladder. Don't do that. I'm going to cleanse my liver. Don't do that. Right? If you're going to do a cleanse, you want to be cleansing all the organs at the same time. Why would you be cleansing the liver and you're just dumping the crap into the small intestine? Why would you do that? You see how it makes no sense when people do that every day? They're like, oh yeah, Dr. Jean-Guy, I'm doing a gallbladder cleanse. I'm drinking this apple juice, you know, with like, you know, 5 gallons of olive oil. I'm like, yeah, that's stupid. Okay? So now you dump that into the gastrointestinal tract and then your gut is, you know, yucky to begin with. Why would you do that? So there's a way that you can do that. And I just don't go on Dr. Google to find that out. Right? So I just want you to have, like, understand. I have a little bit of a passion about those things, and I want to make sure you guys understand that. Can we keep that back door open so there's maybe some air that, because I've got hot flashes. Maybe I have estrogen down there. Okay. So estrogen, this topic here is really important. About the birth control pill is estrogen, then you have estrogen dominant. Even if you don't take the birth control pill, then you have replacement therapy, which is more estrogen. Right? So you have no chance. And men have no chance too because they eat all this stuff that has estrogen in it. So they also have estrogen problem, and when you have an estrogen problem, then you have a libido problem, then you have testosterone problem because they work together. Right? When you don't aromatase your estrogen properly, your testosterone is being driven into more estrogen. Right? So then you have problems with that. So here it says, can this be handled naturally? Can eating food and then whole food supplements can improve your thyroid condition? The answer is like, you know, that's a silly question. The answer is yes, obviously. And I also want to tell you, I like to think outside the box because, you know, not many people do, not many people want to, because people, they want what they want. So if you're a carpenter, everything's a nail, I'm just going to hit it as a nail. However, I just want to remind you, Dr. Jean-Guy, that, you know, I'm a chiropractor, I'm a fan, right? I'm a chiropractor. This is who I am, I'm a fan. I understand about neurology, I understand about how the spine works. I want you to understand about this here. I cannot tell you over the years, 25 years in practice, how many people come in and then their neck is completely messed up, okay? I'm going to use the word messed up. It's very technical, right? Your neck is completely messed up, meaning that if you don't have banana shape in your neck, right, those nerves, they cannot send the right message at the right place. So right at the bottom of your neck, you have nerves that are going to your thyroid gland. I'm going to say this again. Right at the bottom of your neck, there's nerves going to your thyroid gland. So guess what? Potentially, if your neck is out of whack and it's not in proper alignment, could that be affecting your thyroid gland? Say yes. Yes. Yeah, the answer is yes. Matter of fact, in the Journal of Neurology, just about maybe 5, 6, 7 years ago, they take this woman, and this woman had numbness and tingling down her fingers. They're like, okay, no problem. The surgeon comes in. He's like, hey, I'm going to put a plate in there. I'm going to put some screw in there. You're going to be fine. So the surgeon just cut her open, just put the plate in there, put the screws. And then after the surgery, it was successful. She doesn't have any more numbness and pain. However, she started going cuckoo. She's developing psychosis, and then she's putting weight on. So then the lady goes back to the surgeon. The surgeon says, we didn't do anything wrong. Everything was fine. Right? And then she's like, well, can you just look a little bit deeper? And then they're like, okay, well, we're going to do another MRI. I want to check. And then when they checked, then what happened is when the surgeon put the plate in there, he just crushed a nerve going to the thyroid gland. So then they go back in and they're like, hey, I'm going to volunteer for surgery number 2. They take the plate out, they put a plate back in, they make sure that the nerve going to the thyroid gland is working properly. And then guess what happened? The psychosis went away and the weight went away. Right? What's the moral of the story here? I didn't want to tell you about the surgery. I just want you to understand that there's wires that are coming out of this area here that are going to your thyroid gland. So what happened is if a person can be eating some amazing organic food, can be doing everything right, but if your brain is not capable of sending the right message in the right place, do you think that those glands are going to be able to work properly? Yes or no?
No.
The answer is no, right? This young lady, she's the wife of a pastor. When she came in, this was 4 years ago, she's like, the only thing I want is I want babies, right? I want babies. I'm like, okay, well, that's a pretty big demand. I'm a chiropractor. I'm not sure I can just deliver babies, right? But after further investigation, you know, her neck was like it was out of whack, right? Or she had a straight neck instead of having a curve in her neck. So guess what happened? Put a curve in her neck. Now she's 4 babies down. She's got 4 kids, right? Post like saying, Dr. Daigneault, I want babies. And prior to that, like in vitro, like just name it, she had done it all. So what's the moral of the story? Now, I don't tell people like you're going to have babies. I didn't know that. But I just know that if your neck is not where it needs to be, right, that you can have problems with your blood pressure, you can have problems with your lungs, you can have problems with your immune system, because this is all connected. Does that make sense? We started today by thinking outside the box. That's Dr. Daigneault. You know, I want you to understand that. I'm a big fan of nutrition. I'm a big fan of health. You know, I can tell you about all those other things, but I like when I give you some other stuff. So you can understand that sometimes there's more to think about, okay? I can see you guys are in deep thought, right? You're like, oh, that's interesting. Okay. The answer is yes. It's always yes. Okay, Chuck, remember that. Yes. And here it says with a few exceptions. See, I'm protecting you, Chuck.
Thank you.
With a few exceptions. So before we go to that, I just want to answer some questions before we move forward. I think it's a good place to answer some questions. So before I answer the question, so there's different types of people that have thyroid problem, right? So we went over. There's 5 different scenario that people can have issues. If a person has issues with iron, they have an iron problem, they're going to have thyroid problem. A person can have, also here we live in this place called the Border Belt. Have you ever heard of that? In Michigan, the Great North, right? Most people don't have enough iodine into their diet. So there's a doctor in Detroit. If you look him up, he wrote many books. His name is Dr. Brownstein. He's a huge fan. He's a fanatic of using iodine to treat people that have thyroid problems. But now remember, I say that to people and they're like, oh yeah, I'm going to start taking thyroid. It's going to fix all my problem. It just won't, right? Taking just iodine by itself is like beating a dead horse when you don't get to the cause of the problem. Okay, so I never tell people to read books now. I'm going to, I just let the dog out, and you're going to go chase the book and read Dr. Brownstein's book, and he's got great books. You should read them. But I want you to understand, if you have issues with iodine, there's 70 trillion cells in your body, and most of those cells, they have iodine receptors. The iodine receptors are rich into your thyroid gland. This is when you convert T4 to T3. And if you don't have enough iodine, your body cannot do that. And then in this area, the Great North, and I would dare to say it's everywhere the same in the United States, most people don't have enough iodine into their diet. Now, if you have some Morton salt, right, potassium chloride, they usually put iodine in there. Now, back 20, 30 years ago, they used to put iodine in the flour, but that was too healthy. So they took it out and they replaced it with chlorine and bromine, so we can just ruin your pancreas faster. Right, and we can ruin your thyroid faster. Because what happened is chlorine and bromine, those are allergen, and you have allergen receptors, and those allergen receptors are very sensitive to chlorine and bromine. So when you have those chemicals into your body, or you ingest them because you eat cake, cookies, candies, ice cream, bread, rice, and pasta, then what happened is those things will start hooking up to those allergen receptors, and they will not let any room for the iodine. You follow me? So it's not uncommon when we work with people, you don't want to just nutritionally give the body what the body needs, but you also want to detox the body. Do people need to detox? Yeah, everybody. Can you say everybody? Everybody. It's not just one person, it's everybody. So that's really important. This little girl came in, she was just like less than 5 years old at the time, and her mom's name was Rachel. And those guys, they have like their own homestead, right? They homeschool, they have babies at home, all this good stuff. So they come in, they're like Dr. Daigneault, she comes in, this little girl, right at the bottom of her feet, she's got blood coming out, right? The blood is just like seeping at the bottom of her feet. And her mom is concerned, obviously, you'd be too. And she's like, well, what's going on there? Right? And then when we tested her, right, she tested for glyphosate. And then mom started crying. She's like, Dr. Jean-Guy, we don't do that. We're just like homeschool. We're natural. We're hardcore. We just don't eat sugar. We don't do any of that. I'm like, well, does your little girl, does she just walk barefoot around? She's like, yeah, but we don't spray our yard. We don't do any of that. I'm like, yeah, but your neighbors do. Right? So even when you don't do it, like other people do it. It doesn't matter who you are and how perfect you think you are. I mean, we still drink bad water and we just breathe bad air. I mean, it is. So what can we do for it? I don't want you to go to bed tonight and say, I have no chance. I don't want you to think that. I mean, you do have a chance. You know, the chance that you have is to take better care of you. Because the way God made you is when your body's working the way it should, your body has the ability to detoxify. And your body has the ability to handle viruses and to handle, parasites. And your body has the ability to do all those things. Well, you got to take care of it. You're following. You got to have the wisdom to know what needs to be done. So, there's also people that have hyperthyroidism. It doesn't happen very often, but some people have it. When you have hyperthyroidism, those are the people that are usually like they're going to have heart palpitation, can't sleep at night, they're really tiny, they just can't put weight on. But it's not, you don't see that as frequently. Much more frequently in the United States, you're going to see people that have hypothyroidism, and then there's different types. What we saw here tonight. And then people that have this autoimmune, which is Hashimoto's, which is common, and many times they don't even test for that. But if you suspect that you have issues with that, you want to see the whole movie. Because if you have the whole movie, then you'll be able to have a better answer because you understand the movie. Does that make sense? So different types of thyroid, most commonly is the hypo. Hyper does exist. Most of the time, the thyroid is not the problem. I know this is getting complex, but I want to make sure that you understand. It can be up here, it can be up here, it can be here. Now the conversion between T4 to T3 happens in your liver. So if your liver don't work properly, then you're going to be able to convert, yes or no? Your liver is also in charge of removing the toxins, except, including estrogen. Right? So when we test people, when we nutritionally test people, and I'm going to show you how we do that. Many of you already know, but I want to show you so you understand again, because many times, still to this day, there's people I've seen for 20 years. They're like, "What are you doing? Right? What are you doing?" They don't really understand it because maybe they were told or they weren't paying attention at the time. Or some people are like, "I don't care, just do what you do. I trust you." But I want you to understand how important that is because we cover all of that unbeknown to people. Right? We have ways that we can check for all those chemicals, that we can check for pesticides, and we can check for chlorine and for bromine, and we can check for glyphosate. We can check for all that. Matter of fact, we do it every visit. And most people yet don't know that. And then if you have a liver problem, it needs to be addressed. If you have an adrenal problem, it needs to be addressed. If you have, if the thyroid has an issue with the pituitary, it needs to be addressed. It's not just that. Okay? I just want to make sure that we are clear on this because this is important. All of you guys came in tonight. Maybe you had some question. Maybe you don't have a question. You're just curious. I want you to know that the subject of the thyroid is more complex than just saying, well, we're just going to treat my thyroid. Or, I went to see my doctor. And I know what the doctor does most of the time is the doctor will treat your TSH. I know that. Because 20 years of doing clinical nutrition, I see that all the time. And I never tell people, I know this is online here tonight, and I don't know who's watching, and maybe nobody is watching, and that's okay. Maybe a lot of people are watching, but I want to make sure that Dr. Jean-Guy did not say, right? Dr. Jean-Guy did not say, just get off your thyroid medication. Dr. Jean-Guy did not say that. And matter of fact, I never say that to people. Why is that? Because I always encourage people to make sure that we're getting some follow-up blood tests so we can see, right, the trend of what's happening in the body. And you should, because what happened is when you take hormones from the outside in, your body would not know the difference. When you take too much hormones versus taking not enough, the symptoms are the same. You have the exact same symptoms. So how would you know unless you just get checked out? Unless somebody will just do a blood test to see. You would not know. That's why I tell people, if your goal is to take less medication, that's a great goal. To be off of it, I don't know if it's going to happen. But if you don't give your body what it needs nutritionally, then you don't know. So right here in this book, some of you have heard this before, but it's worth telling you the story again. Because I like to repeat myself. I'm hoping somebody can do this one day for me so I can just get out of here. Right? I can be home earlier. So this is a book here put out by the pharmaceutical company. The pharmaceutical company, they put this book, it's called the Drug Information Handbook, right? If you, there's application, you can pay a small fee, they're gonna give you this whole book. This is an older book, I don't buy them anymore because they're just like, because I just don't. Those drugs are not that great for you anyway, but you can look them up in different ways. But they have another book, right? And the other book, it's called the Nutrient Depletion Handbook. The Nutrient Depletion Handbook. So what they do is, they already know, the pharmaceutical company already know when you take this drug, it's going to deplete your body from this, and that, right? When you take this drug, it's going to deplete your body from this, and that. However, very seldom, the doctor would tell you that, right? The pharmacist doesn't tell you that. The doctor is not going to tell you that. But that would be like, even if you're like, doctors are like, yeah, I never want to see you again because I don't really like you. And I'm like, that's okay. But you should probably look this up. If you're taking drugs, you should know that. Because then people are just falling apart and you're like, why is that? Well, there's probably a reason. And the reason is because every drug that a person takes, they're going to have some nutrient that's going to be depleted into your body. And if you don't replenish those, right, your body's just breaking down fast. Do you follow me? So when you're taking thyroid medication, it's going to deplete your body from nutrient depending on which medication that you take. Right? There's synthetic version. There's people, they go to a compound pharmacy where they're going to make it up for you. So I want you to know that this is something that I tell people that when people are taking those thyroid medication, like bring them in so we can check that too, right? Because this is important. You should know that. Oh yes, you can.
Okay,
I'm
so
ready.
say that we were to come in and start to get treated by you.
Yes.
I am hyperthyroidism. I've been twice now because I had my thyroid removed and they grew back, and now that's hyperthyroidism or whatever. So obviously I take medication, right? How would we know the transition from what you're doing and the medication?
Get tested.
I mean, how do you transition into less, you know what I'm saying, medication to?
You go get tested. So let's say you're doing what you're doing now, and then you're getting on a program, the natural program.
Yeah.
Right? So as you're bringing the natural program in, then you can do this with the other one. But you get tested. Right? As one comes up, the other one comes down. You need to be tested. Because what did I say about when people don't test and you keep taking the same amount? It doesn't matter if you're hyper or hypo. The body doesn't know the difference between one versus the other. Right? You could be like, well, I feel better. Well, I understand that, but we still want to see it. Right? We still want to make sure that, the TSH, if you're just looking at the TSH, the normal range is between 0.01 to 4, which is huge, right? If you want to be in a healthy range, you should be below 2. Right? It should be below 2. As long as you see the whole movie, right, the TSH should be below 2. When you get to be at 4, 6, 7, 8, 12, that's a problem. You're not going to feel good. So when a person starts on any kind of program and they take medication, I'll tell people to be off the medication, like we're going to work with the doctor, to redo the blood test so we can see the numbers, how those numbers are changing. So let's say you start on a natural program or you become healthier, or maybe you don't need as much, you're taking this medication for you specifically, right, because you're hyper, that means that this TSH is too low. They want your TSH to go up. Right now, let's say that you go on your follow-up blood test and your TSH is at 6. Now it's too high. Now
Well, it already is there.
Well, here we go.
Yeah.
But there's also such thing as people that have a hyper, and they have a hypo at the same time, right? Those people are just like, they're tired, but yet they can't go to bed. They're so tired that they just can't go to bed. So you have this thing that they have like a physiological thing that is happening to their body that a person can be hyper and hypo at the same time. And that happens in people. And those people are just miserable.
Yes.
Right? Because they're like, nobody understands me. So, but the body gets confused at some point in time. And that's what you want to have, like somebody that can work with specifically with the person to just peel the layers of the onion. You follow? I'm going to give you an example here. Pat's going to be my demo. I pre-framed her tonight. What I'm going to do that in a minute. One more question before Pat helps me out about anything we talked about. Right, I want to show you this here just for a moment so you have the understanding of like how Dr. Jean-Guy, I mean, there's many things that we do, but nutritionally specifically, how I would be working with a person that has some of those symptoms, right, this big list that you have there, or a person they already know they have thyroid problem, either hypo, hyper, or a person already know they have Hashimoto's. When you test the person, this is what's happening in the person's body. So when a person has nutritional deficiencies or toxicity, it's going to create those organs to not work properly. Yes or yes?
Yes.
The answer was yes. And as a result of that, right, thyroid issues could be one of the symptoms. You follow me? I mean, it could be anything. This here can be anything. So when you eat cake, cookies, candies, ice cream, red rice, and pasta, and you do this for a long time, right, your body's going to break down. It doesn't matter. I mean, there's many things that can break down in the body. So the way that we address that nutritionally, this little triangle is to say, hey, if we can eliminate the deficiency, and if there's any kind of toxicity and we can address that, then as a result of that, the body will become healthier and you're going to have a stronger foundation. Does that make sense? Right? So what we do with people here, what I do nutritionally is we use kinesiology testing, which is muscle testing, and we use acupuncture reflexes. Now, this has been around for over 100 years. This is not new. I'm going to show you how that works when Pat comes out of the bathroom there. She got stressed out. She had to do that. Right? So when we do this kinesiology testing is we're using acupuncture reflex to find out if there's any areas of weakness, and if there is, every one of those acupuncture reflex, right, they're connected to an organ. So in acupuncture, this is the lung reflex. In acupuncture, this is, this is the heart reflex. And there's like 50 of them. The adrenal reflex is, is right here. The kidney reflex is lower. The liver reflex is right here. If you go right below the rib cages, you have the gallbladder reflex. You follow me? So you have a bunch of reflexes, and you want to know if any one of those reflexes are weak. And if there's any weak link, then you want to be addressing that. So Pat's going to come in now that she's feeling better. And I'm going to show you how that works. We practiced today for about an hour, so she knows exactly what we're going to be doing, okay? We practiced today. So I'm going to say, Pat, I want you to hold it. So kinesiology testing has been around for over 100 years. You can look it up. I can give you lots of information. You'll be nauseated. Okay, so I say, Pat, go ahead and hold it. Now our brain is focused on one task. Now, of course, you ladies can do 25 tasks at one time, but let's just pretend Pat is a man for now. She's not. But, okay, she's in her nothing box. Okay, so now she's holding. Now I say, go ahead and hold. Now I'm touching her lung reflex. You follow me? And now it's strong. And then I'm touching the other lung reflex, and then it's strong. And then I go over here on the right side, not on the left, on the right side, right here at the bottom of the rib cage, you touch that reflex. This is the liver reflex. And I say, go ahead and hold. And now it's not holding. It's not holding. It's not holding, Pat. She's, I tried to do a demo with her. She's not going along. We practiced for an hour. Just imagine if we would not practice. So I say, Pat, okay, this is weak, Pat, okay? I'm touching the liver reflex, and now she's weak, okay? Meaning this reflex now is like, now what happened is her brain has to focus here, and it has to focus here, two different tasks, right? And as a result of that, what happened is when the brain has to focus on one task only, it's one focus, 100%. Now she's strong. But if you touch an area that doesn't work right, now the brain has to focus on that as well. When I push on her liver reflex, it's called an ischemic reaction. What that means is you're stressing the nervous system. That's what you're doing. You're stressing the nervous system. And if there's a problem, it's going to make it worse. And by bringing this to the awareness of the brain, now it reduces the energy, right? So now she's weak. So now let's pretend. We're just pretending, Pat. We're pretending, Pat, that this is weak, okay? Now what I'm going to do here is I have this here in this little bottle, right? Those are food supplements. There's herbal supplements, there's homeopathic supplements, there's all kinds of different supplements. And then what we do is we take this little bottle, put it over the liver, and I say, go ahead and hold it, but she's still weak, right? So the body says, well, this is good, but that's not good for me. So now I'm going to take another one, right? Some of you are like, well, how do you know which one to take? Well, some of them, they're just for the liver. right? So this was liver 1 bottle. This is liver 2 bottle. I say, go ahead and hold it, and she's weak again, right? She's not holding, she's weak. So body says, I don't like that. This is liver number 3. There's 3 bottles in here for the liver. So then I put over her liver, and I say, go ahead and hold it, and now she's strong. Her body says, hey, I like it. I'm like, okay, Pat, just hold this in your pocket all day. I'm just kidding. This becomes part of her program, right? This becomes part of her program. This is going to be just for her, because this is to support her liver, right? You follow me? So not only she can have it in her pocket if she wants to, but she's gonna physically take it, because this is liver food, right? This will optimize phase 1 and phase 2 liver detoxification. That's what it's going to do. This becomes part of her program. We can do this with every single organ in the body to optimize them. You can do 1 or 2 things. It's either you're going to feed the organ or you're going to detoxify the organ. You follow me? Now, when we detoxify the organ, we look for a lot of different things. We look for food sensitivity, because it's common, right? The top 5 is you have gluten, and then you have dairy, and you have corn, then you have wheat, then you have eggs. Those are the top 5. And then after that, you have beef, and you have tomatoes, and you have chocolate, right? So there's a whole list of things that we check, but those are the most common. And then after that, we check for bugs, because if you have parasites, if you have an infection, that's going to be causing problem with the cell membrane, and the immune system drives the endocrine system. You follow me? The immune system drives the endocrine system. So sometimes people are like, I just want you to work on my hormones. And I'm like, yeah, but this is not how that works. But they're like, no, that's not what I want. I just want you to work on my hormones. But I want you to understand that in the world of health and holistic health, right, your whole body, we don't want to just be treating what you think is not going right because the doctor said. The immune system drives your endocrine system. Understood? So that's important. So we look at parasites, bacteria, viruses, yeast, fungus, all of that. That's number 2. Number 3 is we check for chemicals. Chemicals like pesticides, herbicides, right? Glyphosate. We check for chlorine. We also check for formaldehyde. We also check for any of those chemical that creates a problem. She cannot go. No, she's not going there. Right? She just can't wait to get back and sit there. And then after that, last but not least, is we also check for heavy metals, things like mercury, things like aluminum, things like cadmium or gold or titanium. We check for all of those, right? And then if we find those into the organ, if you find those in the organ, this can be taken out of the organ through a detoxification process. And how do we do that? We use homeopathic stuff to do that. Or we use herbal stuff, liquid herbs to do that. Because what you can do is you can open up the channels, right? The channels, the funnel, those funnels in your body, like the lymphatic system, to get rid of that. So now you detoxify, and then you also feed the organs so you can allow the body to start working better the way God has intended to. Does that make sense? Right? So what we do is we design a clinical nutrition program specifically for that person, and it's just for that person. Just for that person, just for Pat, because she's really special. Right? I mean, if it was Ryan, it would just be a program just for her. It would be a program just for Bill. A person could have the same diagnosis, but yet their program is going to be different. Why is that? Because their needs are different. So how we tackle that nutritionally is we build a foundation. We also look at what people are putting in their body, because that's important, right? If you keep eating cake, cookies, candy, ice cream, bread, rice, and pasta, guess what's going to happen? It's going to be hard to go. You're going uphill. You're trying to push the boulder uphill, right? People are like, can I just get supplements? I got all kinds of money. I'm like, it doesn't matter how much money you have. If you keep eating cake, cookies, candy, ice cream, bread, rice, and pasta, it's not going to work. Right? Just think about that for a minute. So that's important. Now you can go sit. Right? So, that's why it's important. The raw material that you put in your body is important. For all of us, it doesn't matter who you are, it doesn't matter how good you are with your diet. Like, you have to work on that. We all need to work on that. This is the foundation, is putting the raw material into the body. Because when you eat cake, cookies, candy, ice cream, and rice and pasta, you're more likely to have inflammation. You're more likely to have a weak immune system. you're more likely to feed parasites in your body. You're more likely to weaken your immune system so the viruses can do their thing. That's why people have, shingles, and people have, all those viral stuff that you go to the doctor, and what do they want to do for it? Let's give you a shot, because of course, there's a lack of shot in your body. Right? Let's give you the next shot and the next shot. And I tell people, I'm like, listen, we give kids that are like, from the time you're born until you're like 16 years old, if you follow this whole list, you're going to get like at least somewhere between 56 to 66 shots today. Think about that for a minute, right? It doesn't happen in nature. It doesn't happen. The way that you build your immune system is by eating dirt. That's how you build your immune system. You take your kids and you drag them upside down in the dirtiest corner of the house, right? And you make sure they get dirty. And you take the numbie and you just dip it in the dirtiest corner and you stick it in their mouth, right? I grew up on a farm. I would just eat vegetables, take it right from the ground and stick it right in my mouth. No big deal. People think it's like, oh, that's gross. No, it's not. Okay? It's not. It's because you don't understand how the immune system functions. And if your immune system doesn't work properly, then your thyroid is never going to work properly. So that's something that is important. Does that make sense? I want to show you the big picture. The big picture is really, really important. Because you come here and you're like, yeah, what's the pearl here? Give me this one thing. Right? I mean, I give you more than one thing because there's more. That's important. And if you were here for any topic, I would do the same thing. Because this is important. Okay, let's see what we have on this last one. It's a nutrition testing clinical nutrition program. Okay, we've done that. We've done all of it. You guys did amazing. Now, many of you here have done this before, and again, most of the time people don't, you just do it and you still don't know why you do it. But I want to remind you tonight that, if you've been on a nutrition program and you're like, have you ever checked that on me? I'm like, yeah, every time. You just don't know because you're just busy talking or you just don't know. But those little black box there that we put on your body face up and then the other side and then you put your fingers like this and then you put your fingers like this, right? And then you touch those vials and you're like, what am I touching right now? And usually I don't tell people because I don't want to say, well, Jim, why don't you just touch those vials, and I don't tell people. The reason why I don't tell people is because I don't want people to make their own answers. I don't even know. I just go through the 13th step. Because it's easy to just make stuff up. We don't want to make stuff up. We want to be as objective as we can. So when we test a person, people are like, what did you find? I'm like, I don't know yet. I'll let you know when we're done. If you really want to know. And if it's a man, most men, they're like, I don't care. Just tell me what I need to take and I'm going home. And then they get home and then the spouse is like, well, what did he say? I don't know. It's right there. I'm just going to take it. Right? And that's fine. Some people want to know. Some people don't want to know. But I'm just telling you that we do that every time. Because if you want your body to function properly, there's only one or two things that can happen. You can either be nutritionally deficient or you could be toxic. And if you can repair that, if you can fix that, and then you put the raw material in your body, meaning that you stop eating cake, cookies, candies, ice cream, bread, rice, and pasta, and you put more food in, then you build a strong foundation, then you can be healthy as long as possible. Does that make sense? Right? And then the thyroid epidemic, would not be what it is today with 20 million people having thyroid issues. And taking those drugs every day, many people, they still have the same symptoms, they still have the same problem. Right? Because we're not getting to the cause of the problem. I'm really a big fan of getting to the cause. Right? So if you've never had one of our assessments, just to tell you, I know some of you have done this before, but if you've never had one of our assessments, when a person first comes in, people will fill out the questionnaire. Why do we have people fill out the questionnaire? Because nutritionally, when people have nutritional needs, there's early sign that's going to happen in people. Right? You're like, what do you mean? I'm like, well, if you have leg cramps at night, did you know that that's a nutritional problem? Did you know that if you don't have those little moons there on your fingernails that you're having nutritional problem? Do you know that if you just scratch the top of your buttocks there every night, you have parasites, right? Those are questions that we ask people. People are like, well, why are you asking me those things? Because every single question is related to either nutritional, something that is toxic in your body, or either something that is lacking into your body. That's the reason why we have people fill out those questions. When a person they wake up in the morning and they're stiff. Do you know why a person would be stiff in the morning? Now, most people are like, I'm just getting old. No, that's not the answer. When you're stiff in the morning the first hour and then you get looser, that means your liver is clogged up. It's congested. Right? There's a reason. Your body already tells you. It's telling you, but you're not paying attention. Right? Because people don't know. They're like, I'm just stiff. I'm just getting old. Yeah, you're old when you're 100. Before that, you're not old yet. I'll tell you when. Right? You let me tell you when. So, we do this questionnaire, then we do this thing called the BCE. It's a body composition analysis. It gives us insight into the different compartments in the body and how there's inflammation into the body. And then we do this thing called a heart rate variability. And the reason why we do this is because if you go on Dr. Google, you type this in, heart rate variability, there's thousands of studies that tells us about the heart rate variability, tells us how the organs are functioning on the inside. It's a reflection of how the autonomic nervous system is functioning. I know this might not mean a whole lot to you, but in essence, what it means is how the organs are working on the inside. And then last but not least is we're going to do this thing that I just did with Pat, is we're going to do the kinesiology testing assessment. And then once we have all this information on the follow-up visit, then we're going to build a program for the person. We're going to report to them, number one. And then number two is if a person say, okay, I would like to proceed with this here. Okay, if that makes sense to them, they want to do something about it, right? Then we have a game plan of how we're going to tackle this problem. Okay, so this is how we do it. So when a person do that, usually our regular office visit for a new patient is $200. When people come to one of our class, right, is usually what we do is instead of charging people $200, I charge people that sign up to one of our class, we charge them $75. Okay, people always ask me, well, why would you do that? Right? That's a great question. Because when you just come off the street and I have to take all this time with you, right, it takes me a lot of time, so then I charge you more. Now you've been here tonight, you took my time, all of you here, and I'm going to be home late. But now when you come in next time, you're going to be like, okay, I'm ready. Just go ahead because I know exactly what you're going to do already. And I'm like, okay, well then we can both save, right? I'm going to save some time and you're going to save some time because you already know what I'm doing because you already, you've been here. Does that make sense? Right? That's the reason why we do that. Understood? And if you've done it before, hopefully you learned something because when people say, well, what do they do over there? Most people, they cannot even say, what do we do here? And I would like you to be an expert to say, yeah, I know exactly what they do. They just do clinical, they design clinical nutrition program for people. Well, what the heck does that mean? Well, they build specific nutrition program for people so we can restore the person's health. Right? Doing this kinesiology testing, we don't even need to tell anybody about that. And why is that? Because most people don't understand it, just like you don't. And it doesn't matter. At the end of the day, it's like, okay, we restore people's health. How do we do that? We want to find out if you have any kind of deficiencies or if you have any kind of toxicity. And we can fix that. And we can turn this body around because God wants you to be healthy. Right? Now, if you don't believe that, I'm probably not the guy for you. Right? If you keep telling yourself you're old every day, I'm not the guy for you. Because I don't believe that. Right? When Moses died, he was 120 years old. Right before he went to meet God, he had to go up on the mountain at 120, believe it or not. How many people do that? Up on the mountain. Right, 120 years old, and he met the Lord, he met God, and and then this is when he passed, and it says in the scripture that, when Moses died 120 years old, right, it says his vigor was unabated and his eyes were undimmed at 120, right? So I believe that, I believe that for the people that I care for. Now, if you don't want to believe that, then I might not be your guy. Or we might argue a few times. Because I'm going to keep repeating that to you because that's what I believe. Right? But in order to get to that, you got to be taking care of you because, God's giving you how many bodies? Only once. You got to take care of it. Right? And when you're young, I know that this is like news to you guys, but when you're young, the path is wide. But then you can do a lot of mistake and God's going to be very forgiving of your mistake because he knows you're foolish. Right? But when you get older and wiser, the path is not as wide. Yes? You're supposed to be wiser. You're not supposed to be making as many mistakes. So it's not. You have to be on the narrow path, right? Now, some people don't like to hear that. I'm just telling you, that's the good news today. You have to be on the narrow path. Young, foolish. Older and wiser, path is not as wide. right? This is all of you, except this little guy right here, right? Path is wide. For us, we're just like, you gotta line yourself up in the path. Okay, any questions before we go home? Yes.
Are there any particular foods you recommend that help support thyroid function?
I just don't wanna give you a smart answer, cause I was tempted.
You're working on something, I can tell.
Yes.
The
So,
wheels
let me
are
just
turning.
tell you my line of thinking. So because most of the time the thyroid is not the problem, right? When you say, Dr. Jean-Guy, is there's any thyroid food? Yeah, there's people that they cannot eat broccoli because broccoli will affect how their thyroid is functioning, right? However, because I said what I said earlier, most of the time the thyroid is not the problem. So the goal is not so much about focusing on the food for the thyroid, it's about focusing to eat more food for the body so the body can become healthier, right? So what that means is I would have a great focus if it was me. It's not me, but I'm gonna share my ideas, right? If I'm thinking in terms of like, okay, I gotta make sure my liver, based on what he said tonight, he could be lying, but based on what he said tonight, my liver should probably be in good shape, my adrenal should be in good shape. I should make sure my blood sugar is in order, and I want to make sure that my brain is working properly, which is your pituitary and your hypothalamus, right? I said a lot of things so far, but what that means is in order to make those things work, you need to focus on having a lot of vegetables, because this is good for your liver. You want to have a lot of good fat, because those good fat are good for blood sugar. You want to make sure that you want to have some animal protein. Dr. Jean-Guy is not a super fan of people that are vegetarian. You could be one, but most people that are vegetarian, usually they don't know enough about nutrition to get everything they need into their diet, okay? I'm not telling you it's impossible, but usually that's the case. So I think that the goal and the focus is not so much to just zoom in on the thyroid gland, it's to zoom in on like having a healthy liver, healthy blood sugar, making sure the adrenal, you manage your stress properly. And with the adrenals come blood sugar level, right? So those things are important. So having some good fat and good protein and vegetables. And basically you stay away from cake, cookies, candies, ice cream, bread, rice, and pasta, anything that is processed, right? Anything that is either sugar, breaks down into sugar, will just wreak havoc with those hormones. And it's all of them. It's not just one of them. We talked about estrogen tonight quite a bit, but testosterone, it's the same thing. And, cortisol and catecholamine and all those other guys. Right, so there's many players that are affected. Okay. Any other questions? Wow, you guys are amazing. Excellent. No other question. Did I do this in a record time tonight? What time is it? Oh, this is my record. 1 hour and 15 minutes. Never done that before. And this lady came in. She asked Dr. Randy, like, is it just going to be an hour? Dr. Randy's like, yeah. And he's looking at me and he's like, no. I tried. It's the best time I've ever done. It's 1 hour and 15 minutes. The best ever. Okay, let's all.